back here on Healthy Living. We are here with Amy Rainey. It's so good to see you.
Nice to see you.
Learning a lot about what is offered here at Hilton Head Hospital within the diagnostic imaging department. It's pretty amazing. I have some basic questions. First, I'd like to know a little bit about what you do here at the hospital.
Okay, I am the clinical lead of the X-ray and CAT scan department, as well as the imaging supervisor of the radiology department.
Sounds like fun to me.
Oh.
Can I ask some basic questions for our viewers? I think many of us, when we have you captive, we have an opportunity to really find out a lot about what you all do here. And there's so much that you have here at Hilton Head Hospital, I think that people don't really recognize or realize. And so it's a special treat to be able to chat with you. My basic first question is, what is diagnostic imaging? Spoken from someone whose son is a radiologist, I should know this.
Diagnostic imaging is all inclusive of imaging of the whole body, includes all different modalities from MRI, CAT scan, X-ray, ultrasound.
All right, let's go through them again.
Okay.
Start at the beginning. X-ray.
X-ray.
Which is a more traditional, what is an X-ray looking at?
X-ray looks at, it's just one view of the body. We can look at the chest, the legs, any part of the body.
And just for reference at this point in time, when someone comes in through the emergency room and they have a broken leg or
their first stop will be an X-ray.
Okay, first stop will be an X-ray.
And that's just going to show a 2D image of their body, whatever body part they need to be X-rayed, and they'll go from there. Okay,
and we'll talk a little bit more in depth about some of these as we kind of go through this. Number two, let's talk ultrasound, because being a mom, I think of ultrasound strictly as babies, but that's simply not true.
Yeah, they show everything. Yeah, they use sound waves. So X-ray, CAT scan, we use radiation. Ultrasound will use sound waves to be able to look at imaging.
So sound waves for that. And what would that be used for finding?
Babies.
Okay. Okay.
Yeah. They'll look at blood vessels. They'll look at kidneys, livers.
All kinds of things. It's kind of fun. All right. Third, CT scan.
CT scan.
Talk to me about what a CT scan does and what sets it apart from other diagnostic imaging.
So X-ray is like a flat panel plate of an image. So a 2D image, where CT is more of a 3D image. You can see side to side, front to back, top to bottom, spin it around.
Okay, and once again, pretty often used modality for for diagnosing.
Usually a lot of traumas will come in. If it's a trauma from the ER, we'll do it.
Okay, exactly. Does most of your work come from the ER, or is it
everywhere?
Okay.
Yeah, they'll use it CAT scan as an outpatient if they're having abdominal pain and they want to take a closer look at an organ. If they find a mass or abnormal blood levels or anything, we can take a closer look in here.
Okay.
And it helps identify if there is a lesion, what kind of lesion it is, and separate it.
And then fourth, and we're going to talk about this a little bit more in depth in a little while, are MRIs.
Yes.
And how does an MRI differ from a CAT scan?
CAT scan uses radiation, where MRI uses a magnet.
Okay.
CAT scans used more specifically for bone, soft tissue, things like that, where MRI will show more detail on muscle, ligaments, things like that.
We've talked to a lot of people who say that their experience here at Hilton Head Hospital when it comes to the imaging department has been phenomenal. Can you tell us a little bit about how the department really operates?
I think one thing I'm impressed of this department is the teamwork of all the different modalities. I mean, you think of ultrasound, MRI, X-ray, CAT scan, for all of us to work together. You know, if a patient comes in the ER, they're scared.
It's scary, yeah, it is.
And they have multiple tests, so we coordinate with each other to be more efficient for the patient, to make them more comfortable to say, hey, instead of taking the patient for an X-ray, bring them back to the room. Came in for a CT, bring them back to the room. We kind of coordinate with each other and say, hey, what time works best for you? How can we get this patient a quick diagnosis?
What's really interesting, again, in just a little half an hour or so we've spent together, I think that we oftentimes, this is the part of the hospital that we really want to be the best, but we don't really know much about it. So that's why, I mean, it's really exciting to come and be able to sit here and chat with you and hear from you. And everyone who's been here with us has been amazing. They've stopped in, said hi, been curious, and I think that says a lot about our hospital system here.
Yeah, it's a good team.
I really appreciate you visiting, and I know we're going to go talk MRI, so stay with us here on Healthy Living.